Sorry, Pat, I didn't see
No, you're on my
apologies.
Be here supporting the motion and the amendment because I think recent attempts really in the national airwaves and by some members of the Houses through the Sunday newspapers to in fact control the narrative of the reality of the lives of nurses and midwives' pay and working conditions, and the reason why they've been forced into industrial action has been largely discredited by the nurses and their union, and I think has been discredited in the minds of the general public, who are absolutely lock, stock and barrel standing behind the nurses. And the INMO are clear that this dispute is about safe staffing in the public health service, something that's very precious to all of our citizens. And the fact that the HSE hasn't been able to recruit and retain enough nurses and midwives on current pay scales. Now, the narrative, as far as I'm concerned, belongs to those directly affected. I don't have the time to tell their stories, as they've done so eloquently themselves on social media, but a summary of one of them was when she said, all of the nurses have stories like this. We go home sore and sad and tired. We do our best, but we've had enough. We need more nurses. We need better pay and conditions. Please listen to us when we say we need help. And that's the message that's coming out here loud and clear. Since embarking on a programme of austerity, governments successively have undermined the health service and the professions of nursing and midwifery, and there is a cost to that, not just on the shoulders of nurses but also on patients. It's not adequate. The INMO have highlighted previously we're losing Irish-trained staff to the UK and other mainly English-speaking countries, and then the HSE's response is to recruit from outside. It's not cost-effective to pay out over 100 million every year on agency staff when we should be using our resources to create good jobs and retain qualified people in the public service. We need action on this and we need it dealt with now.
Thank you, Deputy Daly.